Welcome to Conversations with T, organic and down-to-earth conversations where we explore the field of perinatal and maternal health and the intersectionality of spirituality and psychology. I am your host and your sister friend, Shatia Tee Owsley, and each episode we will take a deep dive into the outstanding and sacred work of Black and Brown birth workers, spiritualists, and other holistic health professionals making tremendous impacts in the world of birth and women's overall wellness. Together, we will listen to stories, insights, and have meaningful conversations with experts in the field of perinatal and maternal health, psychology, and spiritual health. Whether you're a parent, a birth worker, or maternal health professional, a herbalist, a spiritualist, or just here because you're curious to learn about the world of birth and women's wellness from the lens of some dope Black and Brown wellness professional, you've come to the right place. So grab your headphones, a warm drink, sit back, and let's vibe. Today, I would like to introduce our guest, Nurse Jenna Perkins. Nurse Jenna is a board-certified women's health and gender-related nurse practitioner. She is a member of the Sexual Medicine Society of North America and Nurse Practitioners in Women's Health. She is also the founder and CEO of Discover Her Health, LLC, a practice that treats various conditions in women's wellness. I'm so excited that you're here today. I know I read your bio, just a little bit of it because you do a whole bunch of stuff. So please introduce yourself and let's talk about your journey.
Yeah, hey neighbor.
Hey.
So I'm very excited that you created this platform and created this space for Black and Brown providers and also Black and Brown women to learn from each other. So first, I just want to thank you for that. But yeah, I am Jenna Perkins. I'm a women's health and gender-related nurse practitioner, CEO and founder of Discover Her Health. Our model is the Her model, where we use healthcare, education, and resources to help you tame your most taboo concerns. So that might be hormones, pelvic health, bladder leaks, all the things that really there is a gap in care because traditional OBGYN offices and providers don't have the space or skills to be able to adequately care for these taboo subjects. Excited
Yeah.
to be here.
Yes, absolutely. And for all of y'all that don't know, because y'all don't know, but Jen is my neighbor, and we found that out randomly, and we're me. So I'm so excited that I can actually walk to go see Jenna if I need to see her.
Right. It's literally like, no, when we say being in community, no,
Yes.
you are my community, like
Yes,
literally.
absolutely. So how did you get started in the field?
Yeah. So I was raised by a healer. My grandmother was a folk healer, as people call it. She was a reverend. She was a person, if you had any sort of like emotional, physical thing going on in the hood, she was that granny that, you went to the big house to see.
Mm-hmm.
And she was my primary care provider, not primary care giver growing
Mm-hmm.
up. And so I was able to kind of see the magic of Black women, Black women, and, my
Yes,
whole life.
yes.
So I knew that I wanted to be a healer in some way, and I was open to whatever God had planned for me to do that work. I was very fortunate to be a library kid. I was, that kid that I loved learning.
Mm-hmm.
And so I really excelled academically, and so found myself in a position to be admitted to the University of Pennsylvania, a very prestigious school, and I got my nursing degree from Penn. And I actually started working. I remember saying a prayer and saying, God, like, I really want to help the people that nobody else wants to help. Like, who is the most vulnerable people amongst us? Let me help those people. So, as a research nurse, as an RN, did clinical trials for HIV care, so infectious disease.
Mm-hmm.
And I love doing that work because I always was thinking about like how are Black women represented in this research because we
Mm-hmm.
know that Black women are affected by HIV at rates much higher than our counterparts.
Mm-hmm.
And so that was just like the start of my career of wanting to do the work that nobody else wanted to do.
Mm-hmm.
And so when I went back for my master's, also went back to Penn, knew I wanted to do women's health because Black women, like if we're
Mm-hmm.
talking about who's the most vulnerable, it is us.
Mm-hmm.
So I got my degree, my master's degree, and became a nurse practitioner in women's health. And as I was kind of job hunting, I had the opportunity to do the run-of-the-mill birth work, pregnancy, delivery, all of that stuff. But again, was like, God, like, where am I most needed?
Mm-hmm.
There was a time when I was in undergrad and I was caring for a woman who was having urinary incontinence. And her family, she was fine. She was with it, pretty much doing as you would expect like an 80-year-old woman to be doing. So, but her incontinence was such that her family couldn't take care of her anymore.
Mm-hmm.
And so they were thinking of getting her out of the house and into a facility. And that story just kind of stuck with me. And it was like heartbreaking to know
Mm-hmm.
this woman who has so much life in her was kind of being casted away, like because of this condition.
Mm-hmm.
So, got the opportunity to work in the Department of Urology at GW and help women with their bladder leaks. And everything has kind of built from that foundation. And so the more niche I get, the more I'm like, no, who really, really needs to help me? The more taboo these subjects become.
Mm-hmm.
So bladder leaks, infectious diseases, STI care, but pelvic pain was a big part of it too. So those
Mm-hmm.
women who were having leaks in their bladder were also having painful intimacy, weren't able to ride a bike because they were having so much pain. And so kind of built that pelvic pain practice. The sexual health practice kind of came with that and recognized that hormones affect everything. And so
Mm-hmm.
as I've been able to develop my practice, been able to care for women who have bladder conditions, pelvic pain, and then adding weight management and skincare conditions too, because it's all connected.
Girl, come on, come on. You doing everything, Nurse Jenna. I love
Doing
it.
the most, doing too much. But I love it because that woman that sits in front of me, she's not just coming to talk, or she might just be coming to talk about her bladder. But when I'm able to offer resources for
Mm-hmm.
insulin resistance and weight gain and all of the sequelae that happen from the hormone shifts,
Mm-hmm.
I can treat her as a whole person the way that she deserves.
What do you see as some of the misconceptions about, I guess, receiving this type of care? Because this is not something that's discussed and talked about. And when you go to see your OB, a lot of times it's like, oh, well, let's just kind of wait and see what happens. They're not really quick to give referrals. And a lot of people that I have spoken with, they don't know when they think of PTs or they think of OTs or they think even of nurse practitioners being that specialization in pelvic floor care, or that's not one of the things that they think about, but this is the work that you are doing and others are doing, and it's so needed because, like you said, it's a taboo um, subject. So when people come to see you and you're having the initial consultation, what are some of the misconceptions that people bring to the
Yeah,
table?
I think one of them, and one of the most frustrating ones, is that your OBGYN is equipped to deal with these conditions.
Mm,
We trust our OBGYNs like in our one of the most vulnerable positions, like when you are pregnant, right?
mhm,
And so you think like, yeah, they should be able to help me with like my bladder issues or my sex concerns. But the reality is that, especially with hormone care, you have a generation of providers who have not been taught to care for women in midlife when it comes to these hormone changes. And
mm,
postpartum, it happens too, right? So just the misconception that every provider is trained in this when they are not, and it takes a
mm,
lot of special expertise to really be
mhm.
able to put the pieces of the puzzle together.
Yeah. What are some of the things that on an initial consultation, and I know everyone comes in for different reasons, but let's just say you have a patient or a client that comes in for incontinence. How do you integrate it? It's bigger than this one thing,
Mhm.
right? That we're working with the whole person and the whole body. So how do you approach just putting together and or helping to them to understand what's happening and what's going on?
The first thing I do is give time and space.
Mm,
And so that looks like an hour together for that initial visit. When you're having that 5 to 15 minute visit for your annual well woman exam and you have a lot of concerns, it's not a whole lot of time to really dig deep, build trust. Building trust is absolutely essential. If you don't trust me, then I can give you the best care, but you're not going to utilize it because you don't trust me, right?
Absolutely.
So just having an hour together, that initial visit is very, very important to lay the foundation for the work that we'll do in the future. So it looks like you come in and you say, you know, my friend told me that you helped her with her bladder incontinence, or however or my physical therapist or my OBGYN, because I do get referrals from OBGYNs all the time, thankfully. And so we talk about, okay, like bladder health is one piece of it, but if you are 41 and had a baby 2 years ago, let's also start the conversation about perimenopause, right? And then, so I'll literally go head to toe and I'll say a lot of my clients also experience these conditions or these symptoms. You let me know if you're also experiencing it. And so I literally go head to toe. So we say hair loss. Are you experiencing dry, brittle hair? Vision changes, dry eyes, skin changes? Do you have little moles popping up where you never had moles before? Fine lines, wrinkles, are you experiencing that? What about dental health? Have you lost a tooth in the last year? Because that will happen to a lot of women during the perimenopause and menopause transition. Heart palpitations, weight gain, insomnia, mood changes, brain fog, joint pain. So because I have so much time, I can go deep and really ask these pointed questions that maybe women are experiencing, but didn't even think to bring up to me because I'm talking to you about your bladder, right? So it's like, what does my bladder have to do with insomnia? And I'm like, well, let me tell you. Let me tell you, the reason that you might be having bladder issues is because you have estrogen loss or progesterone loss, and that translates to vaginal dryness too. And that also can cause painful sex, and it can wake you up in the middle of the night because your bladder doesn't have the hormones that it needs. And then if you're not sleeping, you're gaining weight, and then your mood is off, right? So I really just have the space to be able to, again, put the pieces of the puzzle together.
Yeah. I feel like you stepping on my toes. I need to make an appointment. I need to make an appointment.
Was I calling you out?
You
That was a
calling
very
me out.
specific
Yeah, all of my business, all of my business. But no, this conversation is so needed because um not I think now being in my early 40s and talking to my friends, and we're having these conversations, but these were not really conversations that happened when I was a teenager or in my 20s. And so now these things are coming up, and so it's like, I'm the person that you talked about that just had a baby not too long ago in my 40s. And now I'm like, okay. And that brings its own set of new surprises that come along with it. And still nursing, because that drops your hormones levels down to menopausal levels. And I'm like, so I got to go through this three, what is happening? Can you just kind of explain what you see, or what should we be looking out for? Or maybe the question should be is, when do we need to come see you? Like when should this conversation begin? And it's way before 40. I do know that.
Yeah. I like to tell people whenever you have distress, right? Like you might have these very subtle symptoms and they're not really bothering you, like little joint pain, little hot flashes, little night sweats, whatever, but not really bothering me. If you're not distressed by it, then you're not ready to make that investment yet. But when you are like, no, I don't want to deal with this. This is distressing to me. I want better sleep. I want better skin. I want to lose weight, whatever. When you are motivated by that distress, that's the time to come and see a practice like mine or a provider like me. Um, I will say that for Black women in particular, these conversations must happen earlier because our symptoms tend to happen earlier. So the average age of menopause, and menopause just means that you've gone one full calendar year or 12 months without a bleed or a period. Okay, that's really all that means. That is happening on average around 51, 52 here in the United States.
Okay.
For Black women, that's going to be younger, right? And then we have this whole chaotic transition and lead up to that point. So let's say it's a decade-long transition. That's called peri-menopause, where
Mm-hmm.
sometimes you ovulate, sometimes you don't. Sometimes you got a great high amount of hormones, and sometimes you have none at all, right?
Mm-hmm.
So this could be a decade of this kind of just like erratic, chaotic symptoms that you don't really know why it's happening.
Mm-hmm.
So if we're saying 51 on average and we
Mm-hmm.
max that up to 41, so when we start to expect symptoms, knowing again that as a Black woman, it could happen even earlier.
Mm.
Definitely in our 30s, we need to be having these conversations. And I like to say, whenever you're learning about puberty or teaching about puberty, you should also be teaching about reverse puberty,
Mm.
right? So if you're really
Mm-hmm.
teaching about hormones and how they influence the body, then we should be teaching about hormone loss and how that affects the body.
Yeah, absolutely. Yeah. So in that case, because things are happening so much earlier, why are they happening so much earlier for Black and brown women?
Ooh, now that is the research question that needs a whole lot of dollars and I think a whole lot of time and attention. We don't necessarily have the rationale as to why. We know that it
Mm-hmm.
does happen. There are a few theories. One of them is this theory called epigenetics.
Mm-hmm.
Meaning that like what happens to your ancestors, what happened to your grandmother will affect you on a DNA cellular level.
Mm-hmm.
So one of the things that I love to remind people of is that you were inside of your grandmother at one point.
Mm-hmm. Mm-hmm.
When your
Mm-hmm.
grandmother was pregnant, she had that fetus of your mother inside of her, and one of those millions or one of those eggs was you or the precursor to you.
Mm-hmm.
You were experiencing the trauma, the drama, whatever it was that your grandmother was experiencing. And so when you have a population that has been affected by slavery, Jim Crow, redlining, all of these things, then at a cellular level, changes start to happen.
Mm-hmm.
So my theory is that we are experiencing the stress and the trauma of our ancestors, and it is
Mm-hmm.
manifesting in things like increased risk for heart disease, strokes, things like earlier menopause, things like more severe menopause symptoms. Again, this is all theory, and we need a lot more data to be able to say with confidence that this is actually what's happening. But
Mm-hmm.
of course, we don't have that, and I don't see that happening over the next 4 years. But
We'll see. We'll see how things go.
Mhm.
So with things happening so much sooner, and even some people not really recognizing that they're happening, especially when you say in the beginning, it may just be like a little hot flash here, or you're up late here, or you're having mood swings here and there, and you kind of just, oh, my cycle is coming, or kind of brush it off. For those that are now, really paying attention, really tapping in and tuning in with their body and recognizing, hey, no, this is happening a little bit more often. This didn't used to happen before. Prior to coming to you, are there any diet changes, or is exercise, or are there any supplements or things that they can take prior to, or to kind of just help within the process?
Yeah, the
Yeah.
support. Yeah,
Yeah.
definitely. So, vitamin D is one of the things that Black women need to be taking because we have high rates of vitamin D deficiency. Vitamin D is kind of one of the building blocks for good ovarian function and health. So I would say vitamin D is kind of a no-brainer. Also, getting natural vitamin D, so
Mm-hmm.
walking in the sunshine, is going to be super important. Anything to regulate your insulin. So one of the things that happens is estrogen is a hormone, and hormones are just messengers, by the way. They just tell your body what to do. So estrogen helps to sensitize insulin.
Mm.
As estrogen declines, insulin has to work very hard to keep your glucose or your blood sugar levels managed. Okay.
Mm-hmm. Mm-hmm.
And so we can see in midlife, in your 40s, a higher rate of things like prediabetes, diabetes, insulin resistance because of this fact. So if we can give our ovaries a fighting chance by getting vitamin D, by doing those walks, the other thing we can do is manage glucose by helping stay physical, right? So one thing I love to tell women to do is anytime you have a snack or a meal, use that energy so that your body doesn't have to worry about storing it as fat, right? And so that insulin doesn't have to work so hard to get it where it needs to go, right?
Okay.
So walking after a meal is a great way to help with like glucose management. And when we think about these long-term health sequelae like heart disease, diabetes, again, insulin resistance and glucose mismanagement or glucose that is not well controlled is going to be one of the most devastating contributing factors to these long-term health sequelae.
Mm.
So getting vitamin D, walking in the sun, doing those post-eating walks, and then building muscle. Building muscle is absolutely essential. So that might look like instead of going on a run, maybe you start to lift heavy weights so that you can build muscle. It protects the bones. It has great mood support. It helps with glucose control. So lifting weights and then eating protein. And when we're talking about diet, making sure that you're getting a ton of protein, so 100 grams or more when possible,
Okay.
and tons of fiber.
Okay. I'm over here writing notes, Nurse Jenna. I'm writing notes. I'm writing notes.
But I also want to caution and make sure that you understand that you can do all the right things. Once you run out of gas, you're out of gas,
Yeah.
right?
Yeah.
You can't diet your way or exercise your way through menopause, through peri-menopause. Like, yes, it can be supportive and we should be doing these things, but I have a lot of women who are like, I'm doing all the things and I can't lose weight. I'm doing all the things and I still feel like I'm not myself. And so I don't want women to take this advice and being like, well, I won't feel better until I eat more protein. I won't feel better until I can start lifting heavy. There is something that is happening physically to your body that deserves care. And when we can address the hormone loss, a lot of times you're able to do these lifestyle things more readily, more easily because you're able to sleep. You are able to exercise when you sleep. You are, you're seeing the results of the hard work as far as loss when your hormones are optimized. So don't take it personally if you're not getting the results.
Lots of grace during this time. It's a process and it's, a journey for sure. You mentioned through this, the body is going through so many different changes, mind, body, and spirit. And so, as we know, everything is interconnected. It's always going to affect something else in your life. We can't just compartmentalize and just focus on one thing. So, what are some of the things that you encourage your patients to do to support their emotional and their mental well-being? Because this can be a lot, especially if you don't have community. No one talked to you about this before. You go to your doctors, you only have 5 to 10 minutes, and so a lot of people are suffering in silence and just kind of dealing with what's happening. And it's really taking a toll on them mentally and emotionally, affecting their relationships. And so, what are some of the recommendations that you give to just support the mental and the emotional health of the person?
Yeah, I would say acknowledging that it's not in your head, it is your hormones, right? So first, again, giving yourself grace and acknowledging that. Like when you have progesterone's another hormone. When you have progesterone deficiency, there are physical changes that happen. So we could have heavy bleeding. I see this often in like your late 30s and early 40s where your periods are still coming, but now they're like heavier than they've ever been. But at the same time, you can also have mental health ramifications of that progesterone loss, like increased anxiety, right?
Mm,
So
mhm,
again, it's not just in your head, it is an effect of hormone loss. But things that you can do that you can control besides like seeking hormone support and replacement would be finding community,
mhm,
talking to people, letting them know like, hey, this is what I'm struggling with. Have you ever dealt with something like this? Because it might just give them permission to share and be vulnerable with you because they might be feeling the same way, like
mhm.
all my friends are living their best lives and here I am bleeding like a poked pig or not
Right.
sleeping,
Hot. Like,
hot, right? Uncomfortable, bothered, no libido,
yeah.
dry
Right.
vagina,
Right.
all alone, right?
All alone.
And it's like you're not alone.
Mhm,
Other people with bodies like yours are experiencing symptoms like yours, right?
mhm,
So yeah, giving yourself grace and making sure that you prioritize, I want to say self-care, but that's a little bit too general, but
mhm,
truly prioritizing yourself. And that might look like sleep,
mhm,
having
mhm.
good sleep hygiene, making sure that you have boundaries where people know if you text me at 2 o'clock in the morning, there's no way it's going to reach me. I'm sorry. Like
Right.
I'm not,
Right.
I'm not
Right.
responding.
Right.
So yeah, having good sleep hygiene could be something that is actionable that you have control over too.
Mm-hmm. And for when you have your patients who come in and they talk to you about these things, I know some of them may be in relationships. How often are you having conversations with both your patient and their partner, especially a male partner, to discuss, hey, this is what's going on. We need some understanding and some grace and some support. How do those conversations go, and how can partners be a support to
Hmm.
what's going on with their partner?
Yeah, so usually, especially if we're talking about intimacy, libido, painful intercourse, I encourage clients to bring their partner if they aren't there for
Mhm.
that initial visit, bring them to the follow-up visits. One, because it gives you space to just be healed, right? To
Mhm.
receive the healing, to receive the
Mhm.
care versus taking notes and trying to memorize everything that I say. And, being an active participant takes a lot of energy out of you.
Mhm.
Have someone there that can be the note taker, that can be there to remind you, like, hey, remember you were experiencing that symptom? That takes a lot of stress off of you, and it just allows you again to be in the moment, in the now, and receive the care that you are seeking. You
Mhm.
know?
Mhm.
So I highly, highly encourage for partners to be a part of the conversation. It also is much different coming from me in a white coat, being like,
Mhm.
hey, like she's having vaginal dryness, and then I can physically show you using a mirror or a camera how your vulvovaginal tissue changes as a result of
Mhm.
hormone loss. So if I can show
Mhm.
you, hey, your clitoris looks smaller than what I would have expected, then
Mhm.
that could cue to your partner like, oh, I really got to focus in there, right?
Right.
Like if I'm trying to deliver an orgasm,
Right.
you know, or hey, your vestibule, that's the opening to the vagina.
Mhm.
It can be very, 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 very sensitive. In birthing, we call it like the ring of fire, right? You have
Mhm.
lots of nerve endings there. When hormone depletion occurs, that can be quite sensitive and painful. And so if a partner is there, I can show, hey, look how these labia have gotten much smaller than maybe they
Mhm.
once were. Look how
Mhm.
red this vestibule area is.
Mhm.
Look how pale it is. Like that shows me that there's not good blood flow to the area. So she's having dryness. So then when you go back to attempting penetrative play, your partner is going to have that visual and the
Mhm.
knowledge to be like, oh, I really do got to take it slow. You know,
Right.
I really have
Right.
to be careful. I really have to make sure that she's fully aroused, that she has her orgasm first and then
Mhm.
attempt penetration. So it means different things coming from me in a white coat than it might mean from you because all
Mm.
I know is not tonight. I don't want to do that tonight.
Right.
So your
Right.
partner might be experiencing rejection from you trying to practice protection for yourself, right?
Mm, mm-hmm,
And
mm-hmm,
so it might feel less like rejection if I'm saying, hey, these are the physical things that she's experiencing, and that can
mm-hmm.
really be freeing to couples.
Mm-hmm, mm-hmm. Yeah, absolutely. And I can see how it just opens the lines of communication, especially if you have two willing participants, to be able to say, we're in this together, you're not by yourself. Because, like you said, these topics are very taboo. It's very still hush hush. You want to be out here slaying and living your best life and looking cute, but behind closed doors, you are struggling with what your body is, going through. And we know that this is what will happen. However, if it's new to you, you need all the support that you can get. So
Absolutely.
what better support than someone you should be able to be extremely vulnerable with.
Mm-hmm.
So
Mm-hmm. And then it takes
yeah.
away all the ownership of like the intimacy, right? Like it's not just you don't own the sex life between you and your partner. It is
Right.
a relationship.
Absolutely.
And when you
Absolutely.
don't own the pain is not just yours, the pain is y'all's.
Right. We in this together.
We in this together.
Yes, yes, absolutely. So, with you doing the amazing work that you're doing, who else are you collaborating with to provide that integrative support for your patients? Who else is on your roster of you saying, okay, this is a team effort and we're going to work together? Who are you referring your
I
patients to as well?
love this question. So on our website, discoverherhealth.com, we have a list of preferred providers, and we have a ton of resources. So it looks like acupuncturists, it looks like physical therapists, especially pelvic floor physical therapists, chiropractors, OBGYNs and surgeons. It looks like mental health professionals. It looks like nutritionists and dietitians for sure. It looks like health coaches, right? So
Mhm.
other people who have gone through pelvic pain conditions, other people who have experienced incontinence and who are now coaching so that you
Mhm.
have that community there.
Mhm.
Yeah, it looks like, radiology, because you got to get all your screenings, you got to get your mammogram. It looks like colorectal surgeons and gastroenterologists to figure out what's happening in the gut and with your GI system. It looks like exercise specialists is a big part of that too. So if I'm
Mhm.
telling you to go out and start heavy lifting and you've never done that before, how can I, send you out into a world of unknown, right? Like, let me give you
Right.
resources. So it looks like gyms and personal trainers. But yeah, really a full-fledged team.
Mhm.
But I'm looking to you as a client to figure out where you want to start.
Mhm. Mhm.
So
Mhm.
that whatever your priority, if it's mood, then we start with a psych team, right? Like
Okay.
here's your therapist, here's your psychiatrist, and these are the people that I know, love, and trust. And so hopefully I can extend that to you so that you can go in knowing like, hey, Jenna really likes them, Discover
Mhm.
Health really likes them. So I can at least start with a level of trust that's hard to find.
Yeah, absolutely. Now, I do have a question just because we talk about babies here from time to time and we love the babies and pregnancy and all that good stuff. Should you be on a pregnant woman's team from the beginning?
Yeah, especially if there's a level of distress around
Okay.
like urinary incontinence, right? Or urinary tract infections,
Okay.
painful intimacy. I have lots of clients who, did infertility treatments because they had endometriosis. And so they were
Mhm.
so focused on the act of getting pregnant that it was never really a priority to physically feel well in their body. They just wanted to.
Mm.
So
Mhm.
then it becomes, okay, now that I'm pregnant, how can I, on the other side of this, start to relearn myself, my body, and figure out how to feel well in this body.
Mhm. Yeah.
But yeah, I see lots of women immediately postpartum too for things like prolapse, the dryness.
Mhm.
Again, when your hormones are depleted because you're breastfeeding,
Mhm.
look like my menopausal clients, right?
Right.
Your
Yeah.
symptoms are the same. So come
Mhm.
on, let's get some.
Yeah. Yes. So how long after, and I guess because I have heard, especially many of us either are starting over again or having babies later in life, right? So early 40s, mid 40s, some people late 40s, do you see that once they're done breastfeeding, do they just go right into perimenopause? Can they overlap at the same time? Can you be nursing and in perimenopause at the
You could
same
be
time?
pregnant and perimenopausal.
Okay. Okay.
Okay.
Okay.
Perimenopause
Okay.
just means that ovulation is not predictable. It doesn't mean that it
Mm,
doesn't happen. So you could
mm,
certainly be experiencing perimenopause and have a pregnancy.
mm.
Um, but
Just
yeah,
how those people get those surprise babies.
don't you see them? You
Yes.
know, 48 with the double
Yes.
stroller because the
Yes.
boys went on a going out of business sale.
Yes.
And not
Yes.
twins, right? So it definitely happens. Rare, but it can happen.
Okay.
So the transition between postpartum and perimenopause, it becomes very gray because the
Okay.
symptoms, if you're having babies in your 40s, right? Like
Mm-hmm.
the symptoms again are the same. They're the symptoms of an ovulation or no ovulation.
Mm-hmm.
And so then typically the treatment is the same.
Mm-hmm. Okay.
Hmm.
Okay, Dr. Jenna. I mean, Nurse Jenna, I'm gonna be calling you. I clearly I need to be calling you.
True. We have virtual care too. So if you're busy,
Mm-hmm.
like a lot of my clients, and you can't make it out of the house, we can see you from the comfort of your home as long as you're in DC, Maryland, Virginia, Florida, Arizona, Massachusetts, working on some others too. So
Okay. All
yeah.
right. Well, I feel like this is like part one of a 2 or 3 part conversation. I just feel like there's so many paths we can take and so many things that need to be discussed and need to be talked about that we don't discuss and talk about.
Mhm.
And I think that, like you said, it needs to start early. It needs to start when we're talking about, oh, you just started your cycle and this is what's going on with your body. Just even if it's not in the forefront of a 14-year-old's mind that you're going
Mhm.
to go through menopause, right? That seems so far off when you're 14 years old. But to be able to have the conversation of how the body goes through a cycle, and there are different cycles that we're moving through and that we're going through. It's imperative that we talk about it
A
so much
100%.
earlier, so much earlier.
So much earlier. So
Yeah.
I'll give you one. If you can explain to a 14-year-old that estrogen stimulates the lining of the uterus, right? So I like to say, if we're talking about puberty, hey, estrogen is a hormone, it's a messenger, and it's telling the womb, the uterine tissue, to become comfy for a guest, right? Think of
Mm-hmm,
it as like a
mm-hmm,
maid, right? Making a
mm-hmm,
bed. Here are
mm-hmm,
the sheets and the comforters and the pillows,
mm-hmm,
right? It's
mm-hmm,
adding layers.
mm-hmm.
So if we can explain that, then you know that, hey, estrogen is what's building up that lining that then sheds if that guest doesn't come. Okay.
Mhm,
Think of
mhm,
estrogen saying like being that angry maid, like no guest came. I'm gonna, take off
right.
all these layers, right? So that's a period. So if we have that foundational understanding, then we can understand why if you do not have estrogen present, you might not have a cycle, right?
Mhm, mhm,
We could
mhm,
also understand that if you have more estrogen present, that you might have a whole lot of bleeding, a
mhm,
whole, heavy, heavy, painful periods, right?
mhm,
Because you have a whole lot of estrogen and not that progesterone, which is the countering hormone that keeps the lining of the uterus stable.
mhm,
So if we
mhm,
can explain that to young girls so that they understand their cycle, well, on the flip side of that, again, what happens with estrogen loss? Okay, maybe you won't have any bleeding. What happens with
mhm,
progesterone loss? Maybe you'll have erratic bleeding or spotting because progesterone's not there to keep that lining stable.
mhm, mhm.
So two sides of the same coin.
Yeah. When's the book? When you gonna write the kids' book, Doctor? Go ahead. Go ahead. Yeah, I'm just like, oh, that's a good book. That's a good book.
It's in here. It's on its way,
Yes.
manifesting.
Yes.
God's timing for sure.
Yes. Absolutely. But yes, it's important that we start early. It's important that we know our bodies a lot earlier, and it's not so taboo, and that we're able to appreciate them and love them and understand that they are sacred. And, it's a beautiful thing. It may not always feel beautiful, right? But the body is just an amazing thing, right? Just there's still so much unknown about it, and then the womb is just even more sacred, just on what it holds. And we're not just talking about babies, but gifts and dreams and aspirations. And then it also holds trauma and hurt as well. And so understanding how our body is connected, nothing is separate. We cannot separate any part of us. And understanding that mind, body, and spirit connection, it should be it should be a different level of sex education, right? When we're incorporating the whole person and not just the body parts. So
Oneness is truth.
yeah.
When it comes to spirituality, right? Like I believe that I am one with God, God is one with me. I am a part of oneness in God's creation. And the same with your body, right? You are not a walking bladder or just a set of eyes or just some skin, right? You are one. You are one complete being, and a lot of different systems within that. So oneness is truth.
Yeah. Absolutely. You got to come back. We got to do this again. We got to do it.
I would love to.
We have to do it again. But as we close out, I just want to thank you so much for your time, for your work, all that you're doing. It is just such an honor to talk to you and pick your brain and to learn from you and to laugh with you, but most importantly, to be in community with you, because it feels good. It feels good to know that you can call a sister friend, learn from a sister friend, support and collaborate with a sister friend. And we out here doing the Lord's work. Okay. We is out here doing this work. Okay.
Yes.
Yes. But as we close out, I have two more questions for you. And then the first question is, what would you tell your younger self with this journey that you have been through so far? Looking back, if you could tell your younger self one thing, what would it be?
Just keep going and like take that step, and God will lay the path in front of you. It's been so many times where I'm like, I don't know what I'm doing, but I'm doing it. And so just having the confidence to know that like you're doing it well, and it's going to work out.
Absolutely. And where can people find you? What is your social media? What's the website? How can people book with you? Where are
Yeah.
you located? Down the street from me. So
Period. Our physical practice is in Alexandria, Virginia. If you want to see me in person, you can find me on all social media platforms. Discover Her Health, DISCOVHER. And our website is discoverherhealth.com, DISCOVHER health.com.
well, thank you, Nurse Jenna, for being with us today. Oh, I'm so excited, and I can't wait for you to come back. So many good things happening in 2025, so you will definitely see us again. And we will see you on the next episode.